Welcome again to the Active Health Podcast, where we're going to talk all things health, fitness, and performance, and where we believe taking an active role in your health. Today, we're joined by a special patient, Mike, who had been struggling with some unique pain that he wasn't facing a very good outcomes, and was some of the treatment options had been led to really didn't look that optimal, but we were able to help him a little bit. So, Mike, welcome to the show.
Thank you.
You bet. Could you tell us a little bit about what you presented to our office with, like what kind of pain you were having?
Okay. Well, I came in, I had a really bad case of shingles about 3 years ago, and I was left with postherpetic neuralgia as a result of the shingles. And my treatment options weren't really too good. There really aren't any good effective options for that type of pain. The best the medical profession has to offer is pain medication, just to cover up the pain.
Sure.
And gabapentin is one of the most common drugs prescribed, right, and other antidepressants.
You bet. So where was your pain? It was kind of long.
Okay, the pain was underneath, started on my back, came around underneath my arm, and stopped here in the center of my chest.
And so you've been dealing with this for 3 years. And what was the initial cause? Did they have an idea? You had shingles.
The shingles was the cause of it. Yeah.
Right. Okay.
Yeah.
And so then you were dealing with, what level of pain were you at for those 3 years?
Well, I'd say about a level 8, level 7, level 8.
Pretty consistently.
Yeah.
On a daily basis.
Yeah.
And
I was taking really high doses of gabapentin, which has very detrimental side effects. Makes me very tired, and the other side effects are kind of like a brain fog.
Right.
So not good.
and so you were taking those, and was the gabapentin, was it decreasing your pain much?
Yeah, it worked.
It worked, but the side effects
were almost as bad, because you couldn't really do much because you're so tired.
And so did you feel like during those 3 years, what other aspects of your life started to change because of, the pain and the use of the medications and things like that?
Well, it was diminished my life, really.
Right.
Yeah.
So a lot of the activities that you used to like to do, you just weren't participating in anymore.
Less and less. Yeah.
And just kind of consumed by the pain.
Yeah.
And just on a daily basis.
Yeah.
And you were telling me when you came in, you were considering going through a spinal cord stimulator procedure.
That was the next step following. I did try another treatment procedure, which is the nerve injection with steroids.
Right.
And that has proven effective for some people with the similar symptoms, but it didn't work at all for me. And then they did an epidural injection, and that didn't work either. So then the next option was it was a spinal. They use electrolysis. They put a probe near your epidural in your spine, and then they use electrolysis to try and cancel the pain signal.
Correct.
So that was the other option, but my pain level was up high enough that it was very risky.
Right.
Because that can also cause other damage to your nervous system. So,
right. Typically, they reserve those procedures for the real low back area.
Yeah, it's normally done in the lower back.
And they don't typically do it up as high on the spine as where your pain was.
Yeah.
So, I mean, this is one of the reasons that now just Mike's case is not a slam dunk. He's not going to, we're going to get to where he's at today. He's not pain free today, but to kind of paint the picture of where Mike was coming from, he's had a pain for 3 years at a 7 or 8 level. that was due to a virus, a post-shingles virus disease he had, and then attacked the nerves in that rib cage area, and had just chronic pain for those 3 years. Medication was diminishing it a little bit, but he was basically, life was consumed with the pain and then the side effects with the brain fog and lack of energy, and just wasn't able to enjoy life that much. And he was pretty desperate when he first came in, because I think you had mentioned that procedure with the spinal cord stimulator not only was risky, but like because of where it was, potentially your insurance wasn't going to pay for it, and like
the insurance does not cover that because it's not proven.
Right, in that area of the spine. Yeah.
Well, for this type of medical condition, it's not proven, so they don't cover it.
Right.
And it is very expensive.
Right.
Very expensive.
So when Mike came in, to be frank, when you presented with the symptoms, you are our first patient we've treated with this postherpetic neuralgia, which is after the shingles. But we've treated a lot of patients with neuropathy. So because of the similarity and the damage of the nerves, we thought it could be definitely a good option. We just changed the location with our laser of where we treated and the location of the injections. And so again, we kind of had ups and downs through this treatment plan. The most exciting thing is after our first laser treatment, how'd you feel right after that first one?
Well, I definitely felt an improvement. Yeah. So I had hope.
Right. Because I think you came back and you told me that night you had cut your medications in half.
Yeah.
So you on your own, we didn't recommend it. You decided to cut your medication in half that night, which is to me a big win because of the side effects you were getting from that. And then we kind of just steadily went through it. We went through, 6 weeks of doing the laser treatment. We did some injections. We did some manual therapy in the area. And there was some steady improvement. And tell us a little bit about where's your pain level at now?
Well, the pain level is less. It hasn't gone away. And where I'm at now is I feel like I've got the pain is at a 50% reduction.
Right. That's awesome.
And I measure that by the amount of medication that I'm taking, which is 50% less than where I started from.
Good. And so you're getting less side effects from those as well.
So by taking 50% less medication, I have the same pain level. So
that's wonderful.
And that's enough to restore pretty much my normal activity, where I'm able to do what I want to do and get around and do the things I want to do at home and travel.
Yep. And you shared with me,
put me back, get my life back.
Yeah, and you shared with me you went and played some pickleball the other day.
Yeah.
When was the last time you had done that?
Yeah, the thing of strange about this type of injury is that the more you exercise, the better you feel.
Yes.
In other words, I think it's due to the concentration because when you're exercising, you're not thinking about the pain.
Right.
When you sit down and relax and maybe watching TV, then your brain starts thinking about, I've got this pain here.
Exactly. There's a lot of truth to that. Yeah. When you, and with the medications making you not have that energy, unfortunately, you just don't feel like you can go be active. You
have to push yourself to get over that threshold and start doing something.
Right.
And because sometimes it's easier just to sit and feel sorry for yourself.
Yeah.
You don't want to do
that. It's been fun to watch, and you can just tell even from the first day till now, and just your mood, your ability to move around the office is you almost, it was right in those first couple of visits, you just lit up a little bit more because you like you said, you felt hope. It was so fun to see.
I think the even though it was 3 years since I had the shingles, which damaged the nerves, I do feel like the stem cell injection is helpful because hopefully and I think they have already gone in there and done some repair.
Yeah.
And the good thing that you told me was that they'll keep working for about 8 months.
Yes.
So I actually have hope now that over the next 8 months I'll feel even better.
I think you will too.
Yeah.
And over time we may do some more lasers or something else. But I mean, again, I think this is one of those cases where the amount of improvement was the success. I think in so many cases we expect to make it this whole like 100% change, but even just the 50% reduction has allowed you to get your life back.
Yeah, I really never expected a complete, recovery. When you have the amount of pain that I had, 50% is a lot.
Yes. Yeah.
So.
Well, I'm so glad we were able to help. Is there anything else about this situation or your case that you feel like you want to speak on?
Well, anyone that's suffering from the same thing that I am, it's well worth a try.
Absolutely.
Because as I found, there aren't a lot of options. Unfortunately, and your pain doctors you go to will tell you sorry, we don't have a lot of options.
When you don't get hope from your doctors, that's a frustrating situation. You bet.
So.
Well, Mike, I appreciate you sitting down with us and allowing us to discuss your case. So just like Mike said, if you're one of those people that have had shingles and have some residual pain from that, of course there's no guarantees. And even with Mike, 50% reduction in pain, but it's so great to be able to give patients hope and get a large portion of their life back with decrease in their symptoms. And we're doing it naturally without those medications, without the side effects that are affecting your life. So if there's a way we can help, please reach out to us and we'll see if we can help. Thanks again for joining us. We'll see you next time on the next episode.